teach you how to do a breast self-exam at home. So I'm going to give you a handout, and basically what I'm telling you today is on your handout. So the important things is that you want to stand in front of a mirror, you want your arms at your side, you're going to check size and symmetrical of your breast, and the contour of your breast, and characteristics of your nipples. So those are really important things you want to look for. And you want to do this usually 5 to 7 days after your menstrual cycle. So there's a couple different ways you want to check. So ways that you can inspect. The first way is by putting your hands over your head. The second is by at your hip side, and the third is leaning forward. And all these check for bringing out any dimpling or retraction, which is important to check for. Then another thing you're going to do is lay in a supine position, and you're going to check your lateral and medial portion, and that is checking consistency of tissue, any tenderness and nodules that you might find. And we're going to also teach you about breast palpation. So you're going to check your lateral side, which is putting your wrist on your forehead, and you're going to use your second and third and fourth fingers, the finger pads, and you're just going to check in a vertical pattern, and you're checking to see if you feel any nodules, masses, things like that. And then the other way is you're going to check your medial side, and that is putting your hand towards, like on your shoulder towards your neck. And again, you're going to check in a vertical pattern, and you're checking for any nodes or masses that you might feel. And then what we're going to have you do is you're going to divide your breast into 4 quadrants, and you're going to do the face of a clock. And then as you're feeling, you're going to, say if you felt a node, a nodule at like 8 o'clock, you could call your primary care physician and say, I felt a nodule at 8 o'clock. And that gives him more of an idea when you come into the exam to where to look at, really. Then we're going to talk about palpating your nipples. And what you're doing is you're checking for any elasticity, thickening, or discharge. Because any loss of elasticity or thickening or discharge could suggest breast cancer. And so those are important findings that we need to see if we can find. I hope this was helpful, and make sure that you really do breast exams at home. It's a lot of people tend to do them in showers, and they find that very helpful. So if you can do that, that would be great. Start off by doing an exam of your abdomen and your kidneys, and I can see that your hands are by your side, your knees are bent, and your angle's up at a 35-degree angle. And you urinated before we started the exam, so that helps loosen all the muscles for a better exam. So I'm going to start by looking across your abdomen and checking with the good lighting for any pulsation, any peristalsis, any scarring, and I'm looking at your umbilical area for any hernias, and I don't see any. So then from there, I'm going to listen with the stethoscope with the diaphragm, with all 4 quadrants, to listen for bowel sounds. And bowel sounds are present. So then I am going to use the bell of my stethoscope to listen for vascular sounds and bruits. And I'm going to listen in the aorta, renal, iliac, and femoral. This is the aortic, renal, iliac, femoral. And no bruits were heard, so that means there's no signs of stenosis. And now I'm going to do a light palpation. So I'm going to have one hand just slightly over your abdomen, and I'm feeling for any masses or nodules. Are you tender at all? I don't see you grimacing or anything like that. Okay, so that's good. And now I'm going to take both my hands and I'm going to do like a deep palpation over the 4 quads. And I'm feeling for any masses or nodules. Are you tender? I don't see you grimacing either. Okay, so that's good. so I don't note any nodules or masses. You know, at the end of your rib cage, I'm going to press down and palpate, and I don't feel that your liver is palpable. And then I'm going to come over to here, the spleen, and just palpate, and your spleen is non-palpable too. So from there, I'm going to percuss your abdomen, and I'm just going to start percussing. And I'm doing the whole abdomen. And it's tympanic throw up. And so I'm going to start at the mid-breast and mid-clavicular, and I'm going to percuss. And from the lungs, I feel renaissance at first until dullness. And when I feel dullness, I stop, and that is the beginning of the liver. And then we're just going to put a tape there, and then I come across from the umbilical, mid-clavicular, and percuss upward until I feel dullness. And I put a piece of tape there. And that is measuring the end of the liver. And then I'm just going to take the ruler and just measure in centimeters. And that is 8 centimeters, and that means that your liver is within normal range size. Anywhere between 8 and 12 is good. I'm going to find where your spleen is, and it should be between the 6th and 10th rib, so I'm going to just percuss down until I hear dullness. Okay, so I hear dullness here. I'm going to stop, and that is about your 8th rib cage, and that's good because we want it anywhere between 6 and 10. And then from there, I'm going to do palpate your kidneys. So I'm going to do a bimanual exam. So I'm going to put one hand underneath and one hand on top, and I'm going to press down and have you breathe in and out. Take a deep, and your kidneys are palpable. And now I'm going to have you sit up, and I'm going to have you turn, and I'm going to do a fist percussion. So I'm going to check your costovertebral angle for tenderness. And do you feel any tenderness?
No.
Good. I'm going to do the other side, okay? Any tenderness?
Nope.
Okay, that's good.